My name is Kenechukwu Olufemi Chudy-Onwugaje. I am a gastroenterologist and interventional endoscopist at the Redus Center for Digestive Health in Lagos, Nigeria. I also serve as the medical director of the center. Gastroenterology is a branch of medicine that deals with the diagnosis, the management, and the prevention of diseases that affect the digestive tract. The digestive tract includes the esophagus, the stomach, the small intestine, the large intestine. It also includes the bile ducts, the gallbladder, the pancreas, the liver. And in gastroenterology, we deal with conditions that affect these organs that I've described. In the practice of gastroenterology, we use minimally invasive methods to be able to view the intestinal tract. And this is called the practice of gastrointestinal endoscopy. And with interventional endoscopy, we aim to use minimally invasive tools to manage and treat conditions, especially those that affect the bile duct and the pancreas. I decided to be a gastroenterologist because I enjoyed the mixture of the cerebral with the technical that we have with gastroenterology. We have a lot of interesting medical conditions that we manage, but we also have the field of gastrointestinal endoscopy where we use our hands and technical tools to be able to manage and treat disease conditions and to alleviate pain and suffering for our patients. So I enjoy the field a lot, and I'm very passionate about what we do and how we can help patients. Common conditions that we manage in gastroenterology include things like peptic ulcer disease, gastroesophageal reflux disease, what we call heartburn, liver diseases, inflammatory bowel disease. And within the field of interventional endoscopy, we encounter conditions that affect the bile duct, the pancreas, including pancreatic cancer, stones in the bile duct. And we have certain procedures that we use within interventional endoscopy to help to manage these conditions. These conditions help us to be able to access the bile duct and the pancreatic duct, to place stents, be able to go in to take biopsies of the pancreas and of lesions in the stomach using a technology called endoscopic ultrasound. And this modality combines endoscopy with the ultrasound technology to enable us to be able to see the organs that are outside the lumen of the intestines and to be able to diagnose conditions and obtain tissue. I am interested in the growing burden of colorectal cancer in Nigeria, and we should all be concerned by this. Colorectal cancer is a cancer that typically affects people that are much more advanced in age, but we are beginning to see an increasing burden of early onset colorectal cancer in Nigeria, where people who are younger than 50 years of age get diagnosed. The thing with colorectal cancer is that it is preventable. It is preventable through colorectal cancer screening. In developed countries, the recommendation is for all individuals who are at average risk to begin screening at 45 years of age. But in Nigeria, the recommendation by the GI Society is that people start screening at 40 years of age. But many of us are not aware of this recommendation and do not pursue colon cancer screening. So I'm particularly interested in making sure that we work on preventing colon cancer and doing all we can to detect them early when they do happen. My goal with caring for my patients is ensuring that we are trying to restore health in a holistic manner. And we accomplish this through providing compassionate care, making sure that we are there to support our patients and their families along the way in their healing journey. We also want to partner with patients to empower them in their own healing. Our patients need support, but they are the ones who take the lead, and we support them through education, through making sure they have the right information to make the right decisions for their health. What I enjoy most about working with patients is being their partner in getting them back to living productive and healthy lives. When patients come to us, they have conditions that can sometimes significantly impact their functionality and their mental health, besides their physical health. And so when we work together to get them back to full health, is a very rewarding experience for me, and I enjoy that a lot. I also enjoy working with them and their families and just supporting them on their healing journey to full functionality.